So hi everyone, and welcome back to what is the third session in the Center for Environmental Health 6-week maternal and child health webinar series. We at the Center for Environmental Health focus on the protection of families and communities from toxic chemicals. And we do this by developing a number of different resources and tools that we can make available to the community and public. We wanted folks just to be aware of some of the resources that are available in addition to the webinars that we're doing today. We have a report, one which was released last year, that focuses on the ways in which fracking affects the health of mothers, children, and communities by looking at exposure to toxic fracking chemicals and byproducts through the process of air pollution and water contamination. We also look at social stressors associated with heavy industrial activities that accompany tight oil and shale gas development. We also have fracking fact sheet brochures for families, both in English and Spanish, that are currently up on the website. And we are currently working on fact sheets that will be targeting legislators and addressing maternal and child health impacts from hydraulic fracturing. And those will be up on our website soon. So we urge people to check out those resources, or feel free to ask me if you have any questions. So as previous attendees know, in this webinar series, we've been focusing on unconventional natural gas development and extraction, otherwise known as fracking, and exploring the potential health impacts for women of childbearing age, pregnant women, and infants and children. And we are really pleased to have with us today Katie Huffling. With experience with pregnancy and environmental health problems, Ms. Huffling will be speaking about the susceptibility of women and fetuses during pregnancy in connection to unconventional natural gas development and oil. Katie Huffling is a certified nurse midwife and is the director of programs for the Alliance of Nurses for Healthy Environments, where she directs projects related to environmental health nursing practice, research, education, policy, and advocacy. Katie Huffling is part of a national and international network of nurses that work to integrate environmental health into nursing education and provide guidance and resources to pregnant women, parents, and others about health risks to children and their families. Ms. Huffling has also written numerous peer-reviewed articles on environmental health problems and how they relate to pregnancy. In addition, she has developed an assessment tool for nurses and other clinicians to assess for environmental exposures of pregnant women. In 2011, she was a fellow for Reach the Decision Makers program at the UCSF program on reproductive health and the environment. So welcome, Katie. We're so glad to have you with us here today, and I will now turn this over to you so that you can begin your presentation.
Great. Can you all hear me? Hopefully that's a yes. Let's see here. And thank you, Ellen, so much for inviting me to be on part of your webinar series. They've been really great so far, and if all of you haven't been on these previous webinars, they're recorded, and I would highly recommend listening to them, especially the first webinar. Carol Kwiatkowski, who's actually also part of the Reach the Decision Makers team. She and I were teammates. She did an excellent job really exploring what fracking is. I'm going to go in much less greater detail, but it was fabulous. So thank you so much for joining me today. And I wanted to talk about why healthcare providers, public health professionals, scientists, and others are especially concerned about pregnancy and the exposures related to oil and gas drilling, and why pregnant women and their families should be concerned and engaged on this issue. Today, I'm going to review the process of fracking. I'm going to describe some of the factors that make pregnant women and the growing fetus more sensitive to exposures from fracking. I'm going to review some of the growing body of evidence on the negative health effects related to fracking. And finally, I'm going to end with what actions you can take. I think it's really essential with this issue that mothers and families in areas already being impacted by fracking, as well in those in which it could be coming, should be actively involved in this issue. And On this issue, your voices can make a real difference for the health of your families and communities. And so it's so important to be engaged if fracking is already there or if it could be coming to your neighborhood. So I know pregnancy can be a time of great excitement and joy as expectant parents await the arrival of the newest member of their family. It's also a time when many women and their families start to look at their lifestyles and start eating more healthy foods, exercising, looking at things in their environment that could have negative health impacts on their babies and themselves. So why do exposures to chemicals, air pollution, and other things in our environment matter so much during pregnancy? Well, we used to believe that the placenta would filter out whatever a mother had been exposed to, but now we know that that's just not true. During fetal development, there's a carefully orchestrated interplay of physical, electrical, and chemical signaling among the cells and organs, during which this amazing process happens in which the single cell of the fertilized egg forms into the millions of cells that make up a newborn. Exposures during sensitive growth periods during pregnancy can result in these signals getting crossed and can result in, unfortunately, abnormal development in the fetus. These effects may be seen as something readily apparent, such as birth defects, or they can be more subtle, with the impacts becoming apparent over time, such as what we're just now beginning to understand as part of a complex mechanism that could put a child in an increased risk for a number of diseases, such as cancer, diabetes, obesity, and autism. As I'll describe later in the presentation, fracking poses risks for exposures throughout its process, and I'll also be describing some of the research that's just now beginning to show how pregnancies are being impacted. In addition to being concerned about fetal exposures, as a nurse midwife, I'm also concerned about how these exposures can affect women's health. Due to the changes that happen to a woman's body during pregnancy, she can become more sensitive to environmental exposures than she normally would be. For example, hormones during pregnancy can affect the nose, sinus, and lungs. And for many women with asthma, this can make them more prone to asthma attacks. Or if you've never had asthma before, suddenly you may start having asthma symptoms. Uncontrolled asthma during pregnancy can have serious complications to the mom, including high blood pressure and premature delivery, and complications can also impact the baby with increased risks of stillbirth, premature birth, low birth weight, and low APGAR scores. As I'll describe later in the presentation, the fracking process can increase air pollution, which can also cause and worsen asthma. And so that's why it's one of the areas that we're very concerned with exposures during pregnancy. So what is fracking? Hydraulic fracturing or fracking is a term that's used in the media and by others to describe what is actually a much larger process. Fracking is just one portion of this process, and the process also includes things such as well drilling, fracturing fluid production, wastewater disposal, the transportation of materials, and the processing, compression, and transmission of gas and other liquids. This type of unconventional oil and gas development is used to obtain oil and gas that's trapped between layers of dense shale rock found deep below the Earth's surface that would previously have been too difficult and expensive to extract from other traditional methods. Prior to fracking, gas companies drill straight down for thousands of feet. The drilling then turns horizontally, creating a fracturing path that can extend up to 5,000 feet underground. Once the well is completed, millions of gallons of water mixed with sand, salts, and up to 300 tons of chemicals are pumped into the well at high pressure to break up the shale, releasing the gas and oil. The flowback water, which is the water that is mixed with the chemicals and all these things, returning to the surface, contains the fracking chemicals. It's highly concentrated in salts, oil, grease, heavy metals, and naturally occurring radioactive material. Fortunately, normal water treatment facilities are unable to filter out hazardous chemicals and the radiation in the flowback water, creating an issue of what to do with this waste. This type of horizontal drilling and fracking has only been in use for about 10 years, so it's a fairly new technology and we're still discovering how it can impact human health and the environment. This map shows the areas of the US where shale gas is found. Many of these states already have fracking occurring, while in others it's still being debated and has not begun, such as in New York and Maryland. Since it's such a new technology, the residents in areas where fracking is occurring are unfortunately becoming test subjects into the health and environmental impact of fracking. As you'll see in the following slides, there are unfortunately many opportunities for exposures, both through air pollution and water contamination. I wanted to show you a few photos of what drilling sites look like. When fracking and drilling comes in, oftentimes it comes into these beautiful rural areas, and now they're riddled with what are basically industrial sites. Though in some parts of the country, since it is in California, we're seeing some of these sites coming into heavily populated areas, which brings a whole other set of concerns. As you can see, they create these large flat staging areas, the drill pads, and besides the drilling rig, there's equipment to handle water and chemicals used in the process, and there's trucks carrying water, chemicals, and sand coming in and out of this area all the time. It's a 24-hour round-the-clock operation, and there's noise and lights all the time that are not really unexpected in an industrial site, but when you're used to living in a bucolic rural setting, this can be quite jarring, to say the least. This is a photo I took of a compressor station in rural Arkansas a couple months ago. These compressors are needed to be able to push the natural gas through the pipelines crossing fracking country in order to get to processing facilities and power plants. They are noisy, and when I was outside taking these photos, you could smell pollutants in the air. And it was right next to a cow pasture with cows grazing and homes right nearby. And besides the health impacts to the people living there, it's obviously a concern what could be happening to those the cows that were there. Could they be getting into the milk as well as into the meat? When drillers come into an area, they don't just drill one well. In order for the process to be profitable, they must drill multiple wells in an area. They may have to put in new roads as well as drill pad sites, as seen in this picture, and you can see it's incredibly altering to the landscape. Now, in the next few slides, I'm going to describe sources of exposure and how these can impact the health of pregnant women, newborns, and families. As I stated earlier, fracking uses incredibly large amounts of water for the fracking process. They can use up to 1 million gallons of water per frac, and a well can be fracked up to 10 times or more. The oil and gas industry like to highlight that the mixture is 95 to 99% water. But because they use such an enormous amount of water at each fracking site, it ends up being up to 300 tons of chemicals per well. The water and chemicals need to be trucked onto the site, bringing with it diesel truck traffic on rural and oftentimes unpaved roads, and then we're all breathing in this massive amount of diesel exhaust and particulate matter, which I'll be describing when I talk about air pollution. Depending on the regulations in the state where fracking is occurring, the wastewater that comes up after the fracking process may be held in wastewater pits or in storage tanks. Because it's becoming increasingly difficult to dispose of the wastewater, and also due to water shortages, they may reuse the wastewater in other wells. They may also inject the water in injection wells, and probably many of you on the call have heard news reports. It's been in the news quite a bit recently in different areas with injection wells now having earthquakes due to those injection wells. They may also legally or illegally spray the waste on roadways to combat dust, or in some parts of the country on icy roads. And they may illegally dump into our waterways. At any one of these points, there's opportunities for exposures, leaks, and spills. There's no good solution for fracking wastewater, as sewage treatment plants cannot make the wastewater safe, and it can't be put back into the drinking water supply. At a time when many parts of the United States are in drought, using millions of gallons of water that can never be used again, I feel is a tragic waste of our most valuable natural resource. This is just a list of some of the things that you may find in fracking wastewater. Um, Wastewater contains things such as methane, which is actually what natural gas is, hydrocarbons such as benzene and toluene, heavy metals, salts, as well as naturally occurring radioactive materials. One of the reasons scientists started looking at water contamination as a source of exposure to toxic chemicals was due to issues seen in farm animals exposed to fracking wastewater. Farmers at different sites noted both cows and goats experiencing things such as stillbirths and birth defects. This type of issue with farm animals increases, raises the alarm that human health may also be impacted, and really shows that we need to be researching these things before we put them into practice, or to make sure that environmental controls are in place to prevent these types of things from happening. A study in 2011 found that private drinking water wells had on average methane levels 17 times higher near drilling sites compared to those in non-drilling sites. Methane is a concern because it displaces oxygen in the air and can cause difficulties breathing. And, especially during pregnancy, if you're already having issues with breathing, you definitely do not want to be exposed to this chemical. If levels of methane get high enough, it also raises concerns for explosions. Arsenics and other solids can come up in the fracking wastewater, and these include things like selenium, barium, and strontium. And these have been linked to a number of different health concerns, such as digestive problems, skin changes and rashes, decreased feeling in the hands and feet, cancer, and even death. One of these that I find very concerning, that I think for pregnant women and for women that have kids at home, is strontium. It can weaken the bones, and children seem to be the most susceptible to this effect. As I had stated before, there's a large number of chemicals used in fracking, or quantity, and there's also a large number of chemicals used. And an evaluation of the chemicals mixtures used in the fracking operation, researchers found over 350 different chemicals that were used in over 900 different products. Of these chemicals, 75% have been linked to skin, eye, respiratory, and digestive problems. Another 40 to 50% have been linked to brain and nervous system, immune system, cardiovascular, and kidney problems. 37% can impact the endocrine system or endocrine disrupting, and 25% can cause cancer or mutations in cells. Of special concern during pregnancy are the endocrine disrupting chemicals. Endocrine disruptors are chemicals that may interfere with the body's endocrine system, which is the hormone messaging system of the body. And it can produce negative developmental, reproductive, neurological, and immune effects, and we see these both in humans and in animals. The growing fetus can be especially sensitive to these chemicals, as they disrupt that carefully orchestrated process that occurs throughout fetal development, like I described earlier in the presentation. These chemicals can have effects at very low doses, and fetal exposures have been linked to health issues later in life, such as infertility, learning disabilities, cancer, diabetes, and obesity. This group of chemicals, they're called BTEX, and you'll see this used in a lot of fracking literature. Benzene, toluene, ethylbenzene, and xylenes. These are volatile organic compounds, and they're very commonly used in the fracking process. Each of them have been linked to a number of different health effects, and many of these are of special concern during pregnancy. Benzene is a known human carcinogen, and it's also been linked to brain and spinal cord birth defects, which are also called neural tube defects. Toluene can cause miscarriages and has been linked to placenta previa, where the placenta attaches lower in the uterus than it normally should, and that can make the pregnancy higher risk. Toluene may also cause developmental delays in kids and behavioral problems. Here's an example of some of the contaminants found in the well water of a family living near a fracking site. And these are only a few of the things that were tested. As shown in the previous slides, there's the possibility of hundreds of different chemicals being used at any one site, And it can be difficult to figure out what chemicals should be tested for, as well as being almost prohibitively expensive for most of us to be testing well water to see what we could be possibly exposed to. Besides water contamination, we're also seeing air pollution in areas with drilling and fracking. Methane and compounds such as BTEX are also found in the air, not just in the water. These air pollutions or pollutants are released during the drilling and fracking process at compressor stations like that one I showed earlier, during the production of fracking fluids when they're pulling together these different chemicals into a mixture, and when they burn off excess gas, which is also called flaring. With the increased truck traffic, you also get increased levels of diesel dust exhaust, as well as increased levels of particulate matter, which is dust and other small particles which is released into the air. Besides the pollution, which I'm going to describe in more detail on the next slide, this increased truck traffic can cause other effects in the community. Rural communities that normally have little traffic suddenly have to deal with a massive increase in truck traffic. There's many more traffic accidents, the more roads need more frequent repair, and there's increased congestion and idling. And the idling, if anyone's ever sat, in traffic or outside a school when there's a bunch of school buses sitting there idling, the pollution is definitely apparent. Many communities are also finding more trash along the roads, as the drivers are oftentimes not from that community and don't have the same level of community pride and engagement that keeps them from not throwing their trash out their truck windows, which is really unfortunate. When BTEX mixes with nitrogen oxide, which is a chemical commonly found near fracking sites, it mixes to make ground level ozone. And this ozone is different from the ozone found high in the atmosphere and can cause breathing issues and worsen problems such as asthma. New research is now starting to find out that ozone, as well as these mixtures of chemicals in the air pollution near fracking sites, may increase the risk of birth defects and other negative impacts on pregnancy. As I had stated earlier about the asthma during pregnancy, definitely the ozone and asthma during pregnancy is of great concern. As a nurse midwife, my specialty is in taking care of women during normal pregnancy. And if I have a patient that has uncontrolled asthma during pregnancy, they suddenly get bumped out of my practice and into a high-risk group. So besides having that, much more costly healthcare costs and just the stress of having a difficult chronic disease, it just really makes their care that much more intensive. Air pollution is increasingly being shown to have negative effects on pregnancy. In a recent study that looked at over 100,000 live births in rural Colorado, the researchers found an association between living closer to fracking sites and an increased rate of heart defects and neural tube defects. And you might remember from before, those are the heart and brain and spine defects. If you want to hear more about the study, you are in luck, because Dr. McKenzie, one of the study's authors, will be talking about her research on one of the last webinars in this series. So I can't wait to hear that talk. Low birth weight babies can have more problems right after birth, such as difficulty breathing on their own, increased risk of infection, and possibly having to stay in the neonatal intensive care unit later in life. In a study looking at over 100 million births from, not 100 million, I'm sorry, misspoke, 1 million births in Pennsylvania from 2003 to 2010, the researchers found an increase in the number of low birth weight, as well as lower APGAR scores at 5 minutes in infants born to mothers living within 2.5 kilometers, which is about 1.6 miles, of a fracking site. And they compare that to infants born to mothers living further than 2.5 kilometers from a well. And what the APGAR score tells us is we do it at 1 minute after birth and then 5 minutes after birth. And it just gives us a sense of how that baby is doing right after they're born and whether we might need to do any type of resuscitation or take a little bit extra care with that baby. The highest score that you can get is a 10. Most babies get around an 8 or a 10. And so this just shows us that these babies may have been having a little bit harder time in utero due to that air pollution during pregnancy. These symptoms are commonly found in people living near fracking sites, and they've been consistently documented by healthcare providers and scientists. And these can be just a real drag. And I can just imagine if you're already, pregnant and feeling some of these symptoms, it can be really challenging. Nausea and vomiting and nosebleeds and headaches are all common things during pregnancy. And so it can be a real challenge for both the pregnant woman as well as the healthcare providers to tease out whether these symptoms could be something from pregnancy or if it's related to some exposures happening in the environment due to fracking and the gas extraction process. Other things that we're seeing are some of these social side effects. In many areas, you have this large influx of a young, mostly male workforce, and they don't have anything to do on their time off, and so they end up drinking. There may be some drug use, and we're seeing increased emergency room visits due to that drug and alcohol use. We're also seeing rising rates of sexually transmitted diseases in some of these areas. Housing can become more expensive, which creates housing instability for local residents. And pregnant women can be one of the populations that's more at risk for financial and housing instability. So this is a concern for us working with pregnant women. Besides these issues, having a 24-hour industrial facility right next door or right down the street where you've got noise and light 24 hours a day can increase the stress levels of those living nearby. It can decrease the amount of sleep that you're able to get. And being in that stress mode all the time can have serious health consequences. Increased stress during pregnancy has been linked to preterm birth, so it's just another factor that healthcare providers and women need to be aware of in areas where fracking is going on. So I've just given a couple of examples, but I think it's pretty obvious that we really don't know exactly, everything that is going on with fracking, what all the exact exposures are, what are the exact health impacts. And there's a number of reasons why we don't know more about this. One is that there's a non-disclosure by the industry. They're able to keep many of the chemical mixtures that they're using in the fracking process from the public by claiming that they're proprietary or confidential business information. This can make it difficult for scientists and healthcare providers to monitor for exposures and health impacts. In communities where impacts are being seen, community members may sign non-disclosure agreements if they're able to get a monetary award, such as if their well water was contaminated and they now need to have water trucked in. They may sign a non-disclosure agreement with the company in order to get fresh water brought to their home. And this is really tough because they can't even tell their neighbors that the water was polluted. And my concern is that there could be a pregnant woman living next door to one of these people and doesn't know that the water she's drinking could potentially be contaminated. And if there's some endocrine disrupting chemicals or other chemicals in there, how could that be impacting her pregnancy? In some states, there are also gag orders on healthcare providers that keep them from disclosing chemical information that they gain from the companies that is being used to treat patients. They can't even disclose this information to the patient. They might not be able to disclose it to other healthcare providers. And this is of a concern because we can't do good research and good tracking on exposures and health impacts if we don't know what we're being exposed to. And so this has really impeded the research process. Also, the science is really new. As I stated earlier, this process has only been used for a little over 10 years. And when you look at all of the published research on health and environmental impacts that have been published over the past 10 years or so, over 50% of them have come out in the past 18 months. And so it's really new information, and I don't even think have gotten, the tip of the iceberg as far as health and environmental impacts. So what can you do? There are many things that you can do to protect your baby, family, and community, whether fracking is already occurring there or if it's not there yet. I think one message that you should try to take away from today's webinar is that we all must be doing something. This is of vital importance. The water can never be used again. There's concerns in the areas where fracking's occurring that we'll never be able to use that land the same way again. And so we really need to be moving slowly with this process, and policymakers need to hear from community members. So it's really important that we all participate in this process. If you live in an area where fracking is occurring, you should have your well water tested by a professional, hopefully before fracking occurs. And then anytime the gas well is drilled, you should retest your water. We recommend that you check your water testing guidelines that are specific to your area. And one caveat that I have is that they're not going to be able to test for every single chemical. It would be prohibitively expensive, but you should not test your water because you can't test for everything. I know the Ohio Department of the Environment has a nice, I'm sorry, and I meant to put their link to their sheet on this. They kind of do 3 levels. So, if you can only afford to do level 1, there's these chemicals you should test for, and then they have level 2, level 3, if you have a lot more money. And you may be able to negotiate something with the local fracking companies to possibly test your well water as well. You should also be aware of the air quality in your area. If you notice smoke, smog, or a different smell outside, then you should limit your outside activities. And if you have little kids at home or a newborn, definitely bring them inside. Babies and children, they breathe in a lot more air than you or I do by body weight, just the way that their bodies work. And so, they could be particularly susceptible to some of these pollutants. You should also keep a record of the air quality. And you should see your healthcare provider if you have shortness of breath or getting easily tired. And if you're asthmatic, then definitely monitoring your asthma using a peak flow meter and keeping records of the testing. And if you start to have symptoms, you should keep a record to see if they're related to air quality as well. You should document the health status of all your family members before drilling and fracking begins in your community, and ask that that be included in the health files at by your healthcare provider. We really need more information about what's going on in communities before and after fracking goes in. Unfortunately, in a lot of the communities where fracking is already occurring, we don't have baseline data showing how people were feeling before fracking came in, and so we have nothing to compare it with, and this can be a real challenge when oil and gas companies are saying, people were already sick before, you can't show that there was any change. And again, if you start to feel any type of health symptoms or notice that they coincide with changes in air quality or tastes in your water, different color in your water, then making sure that you're keeping records and reporting them to somebody, whether it's your healthcare provider, local health department. It's really important. And you should talk to your neighbors. Are they noticing air pollution? Are they having symptoms? Are they noticing things in their water? This is the time where we need to be a community and take care of one another and be a good neighbor, and not let non-disclosure agreements happen without telling each other problems that are going on. Because I'm really concerned with, that these types of non-disclosure agreements or not talking to our neighbors could lead to some women being unwittingly exposed to harmful chemicals. And also, you should consider the products that you use. One thing that I think a lot of us don't realize is that natural gas isn't just used for heating our homes or powering our power plants. But it also goes to refineries such as this one, which are often located in lower income minority population communities, and they're very polluting, and they also, they produce a lot of the products that we use every day. Everything from ingredients in cosmetics, plastics, fragrances, pesticides that might be used in agriculture. And so considering the full life cycle of natural gas and what we're doing with it, I think is an important part of this conversation and to be aware of as we're talking about fracking in communities and why we need to have more natural gas. And you need to get involved. The community's voice is very important as debates around fracking occur in many states. There are many community groups working on this issue, and you can become involved with them. You can become involved by writing and visiting with legislators. One of my colleagues, every time she was pregnant, we would pull her to every legislative visit, everything that we could think of, because having a pregnant woman, they just can't say anything bad to them. So it's a great time to use your pregnancy for a really good cause. You can provide testimonies at local hearings. You can participate in activities such as rallies supporting clean air and water policies related to fracking. You can become part of state or local fracking commissions. There's a lot of opportunities for community input. And you can also support public access to information about fracking chemicals so that companies have to disclose what they're using at different sites. Also, research into the health effects of fracking is very important. You can encourage your policymakers and legislators to require health studies be completed before fracking is allowed in your area, so you can get that baseline data that I was talking about. And once drilling has begun, you and your neighbors should watch for exposure symptoms and report those symptoms to your local healthcare providers. And if needed, you can also participate in community-based research. They're always looking for people to participate in this, and that can be a real contribution to the science. And finally, I just have a few resources here. The Endocrine Disruption Exchange, Carol Kwiatkowski is their executive director, and she gave the first talk in this webinar series. They have a lot of excellent resources on the health impacts of fracking and on the different chemicals. It's a great website if you really want to dig deep into this topic. Our organization has a special part on our website on frackingandhealth.org. We have several fact sheets on fracking, one that you can give to your healthcare providers, another for the public, and then one for legislators. We also have a link to the CEH report that they did earlier this year on fracking and maternal child health, which is excellent. And then the pediatric environmental health specialty units have a couple of great fact sheets on fracking and how it impacts pediatric health, which I think is gives a really nice overview, and it's also something that you can give to your healthcare providers. They also have lots of experience dealing with chemical exposures, and so if there is a concern that you've been exposed in your community as a pregnant woman, you can have your midwife or your OBGYN give them a call, and they can help with determining if certain tests are needed, certain treatment protocols, that type of thing. They're experts in that, and it's and they know the toxicologists and people like that to do referrals to. So they're a great resource. And so thank you so much for joining me here today. I know it's been kind of a quick overview, but I didn't want to go too deep into the weeds, just to provide a sense of why it's so important that we need to be aware of this issue and why pregnant women need to be a little more cautious than the general population. So thank you.
Great. Thank you, Katie. Thank you so much. Thank you for educating us about why there is an increased susceptibility for problems from chemical exposure, such as those associated with air and water pollution from the fracking processes. You really did a great job of outlining those. I think it was also a really good reminder when you mentioned how it is not just the rural communities that are affected, but also those heavily populated areas, such as in California, that are being impacted. And as you said, the ramifications of this are important because we're seeing the landscape of fracking changing across the country, and the number of communities impacted is only growing, as we can tell. So,
Mhm.
and also think it was very useful to understand, how air pollution impacts pregnancy, and how you mentioned the non-disclosure process by the industry and how that's affecting the process, and how we really need to be focusing on the science and the research to be able to understand more about the processes and how the health impacts are affecting everyone. So, thank you for that. I think now would be a good time to turn over to everyone else for questions. So, attendees, if you have questions, please go ahead and type your questions into the chat box at the bottom of the GoToWebinar control panel. And as with last time, with the other sessions, we'll be answering those questions in the order in which they are received. So, Katie, one of the first questions is about the assessment tool for nurses and clinicians that you've been working on. Is this something that's being used, and what is the plan for this tool? Would you mind mentioning just a little bit of something about that?
Sure. So it's a general tool, and it is being used in a number of practices around the country. And basically, what it does is it assesses for a broad number of, I'd say, kind of typical environmental exposures that are of concern both pre-pregnancy and during pregnancy. And what I tried to make it is something that's easy to use both for the patient and the clinician, and also an opportunity for teaching. So it's got a question, then why are we asking this question? So just a brief tidbit on why it's important during pregnancy, and then what you can do about it. And I specifically focused on things that you can do something about, because I think it's a real drag if we're telling you about problems and there's nothing you can do about it. So and that's also available on our website, and I'm happy to make it something that you could also post with the talk as well. It's free for anyone to use.
Great. I think that
Mm-hmm.
would be very useful for some people. Another question that's come in is, what other studies besides the McKenzie study has focused on pregnancy and exposure? Are there other studies out there besides the McKenzie study?
Right, so the other one that I mentioned is by Elaine Hill, and and that's the Pennsylvania study. Um, I'm not really sure what's in the works, and it's a real challenge out there right now because a lot of the research really isn't being funded. And this type of research is really challenging and expensive to do. I think, getting some really good baseline data would do a lot of good, but unfortunately, we're not there yet.
And we have a question here from Mary Jensen. She says, what is the usual mechanism by which gag orders on health personnel are implemented?
So what happens is if you're a healthcare provider in an emergency situation, you may not have to sign the disclosure agreement at that moment. Like, they may give you the information if it's an emergency, and then you have to sign afterwards. If it's a non-emergent situation, in order to get the chemical company or the gas company to release the ingredients within the chemical mixture, they do make you sign a non-disclosure agreement, which outlines who you can provide that information to. And unfortunately, a lot of times that also includes that you cannot tell the patient what they're exposed to, which I think is completely unethical. I can't imagine having a patient who had been exposed to something that could potentially cause birth defects, could cause cancer, and then saying, I'm sorry, I can't tell you what you were exposed to. And so that's something a lot of healthcare providers in states where fracking is occurring are really fighting, because we do feel like it's so unethical not to be able to tell a patient.
Okay, great. And can you go over a little bit again? Another question is what families can do when they're communicating with their healthcare providers. What have you found is the best way or strategy to deal with that? If they're experiencing impacts in their communities, what would you advise would be the best way for them to handle that communication?
Well, I would say, like I was saying, to document the symptoms that they're having, and if you're experiencing any, changes in the smell, the look of air, if you're noticing any air impacts or water impacts, seeing if they coincide. And I would just keep a record. And then when you go see your healthcare provider, ask them specifically to put that in your healthcare information, that it's in your chart. Because one of the things that I've been finding anecdotally is that healthcare providers may not be noting that. And I think it's really important to have that documented within your chart.
Okay, great. And then we have another question here that they want to know, are there studies out there that isolate the impact of environmental exposures from fracking on birth outcomes from other factors, such as chronic stress and smoking, etc.?
So, I think when they do these large scale studies, like the McKinsey study, they try to tease out what some of these other factors may be. And it can be a real challenge to tease out where all those different factors come into play. And that's definitely a challenge in this type of research. Because we are exposed to so many different things every day, and there's so many environmental factors to consider. Um, so I'm really interested to listen to Dr. McKenzie and hear how they were able to do the research that they've been doing in Colorado.
Okay, thank you. And
Mhm.
then you mentioned how people can get their well water tested. I think you had mentioned some source or organization that maybe is available to test water. Is that right? You
Uh,
mentioned.
no, I mean, I would, for water testing, I would recommend that you call your local health department and they can recommend companies or that do that type of testing. But I can give you the link for this. I know the Ohio, I think it's Department of the Environment, has a very nice fact sheet on kind of why you want to be doing the testing, when to do it. And then they outline some of the things that you should be testing for. It's not an exhaustive list and it may not apply to every part of the country, but I think it's a really nice beginning step. And unfortunately, this testing can be fairly expensive. Anywhere from a few $100s up to a few $1,000s. And in a lot of parts of the country where fracking is occurring, that really prices it out for a lot of families, unfortunately. And I think that's something that needs to be addressed when fracking comes into a community, that they should be having to test the water for families and the wells before they come in if they're not able to afford it themselves.
And we have one last question here from Dale Lyons, who says, as a healthcare professional, how does one obtain the CAS number for chemicals that are considered proprietary?
I'm not quite sure how to answer that. So can that be one of the ones that we put on the?
Yeah. So what we'll do, Dale, is we'll be sure to get back to you. We'll record that question and we'll find out the answer for you. So thank you to everyone for your questions. If you do have further questions, feel free to reach out, send those questions to me, or email Katie directly. Either way, we'll figure out some way to get your questions answered. So we will now go ahead and finish and wrap up. Um, One of the things that I wanted just people to make sure that they're aware of is that we still have 3 more sessions available in the webinar series. So next week we'll be joined by Dr. David Carpenter from the Institute for Health and the Environment from the State University at Albany. Dr. Carpenter will be speaking about environmental exposures and reduced cognitive function in children. He will be talking about those environmental exposures that potentially from hydraulic fracturing could potentially lead to decreased cognitive function specifically. And then we'll have a number of talks after that. So please, so we urge people to go ahead and register if they haven't already done so, to check out our website, or reach out to me if you have any problems with that. And as we've done with the other talks, we'll be posting the recording of the talk, as well as the slides. Currently, we have for sessions 1 and sessions 2, the slides are already up on our website. And the recording for session 1 is already up there. The recording for session 2 will be up there shortly. And we'll be posting the slides from Katie's lecture, as well as her slides, over the next few days. So we'll be sure to make those available. So thank you again, everybody. And please take care. And we hope to see you again next week. Bye.
Thanks.